Hi, in this video we will be showing you with my colleague Teemu how you can get relief by stretching and mobilizing your SI joint. The SI joint is a super stable joint, the most stablest joint there is, and this is because of its form. Even the form of this joint locks the joint nicely and packs it tight, and it's additionally packed with lots of ligaments that restrict excessive movement. And on top of it, you have also muscles that increase the stability of this joint. For example, the multifidus muscles on your back, the deep transverse abdominal muscle, also piriformis muscle, gluteus maximus muscle, and the latissimus dorsi muscle. So lots of packing material. And because the SI joint is the most stablest joint ever, it's hard to dislocate it. You need a high energy trauma to get it dislocated. For example, falling from heights or getting hit by a car accident, or if you get kicked by a mule into your pelvis or a horse. However, during the pregnancy, due to different levels of hormones, joints get more lax, and this can cause problems. A normally tight joint can become less tight so that your big-headed ray of sunshine can pass through to this realm of existence and suffering. The SI joint can become also locally inflamed, and if the inflammation gets severe, a cortisone injection straight to the joint might be needed. I'm no doctor, but this is what I've heard the bigwigs talk in the sauna. Although the SI joint doesn't dislocate easily, many feel that their SI joint or their pelvis is misaligned, and many have also found relief from SI joint specific mobilization techniques. So it's worth trying these exercises and techniques, even though some of the rehabilitation experts may frown upon the idea that you can mobilize the SI joint. Traditionally speaking, the SI joint has different positions that it can get misaligned. So for example, if this is the sacrum and this is the ilium can rise up, go down, rotate forwards, rotate backwards, and also the sacrum can side bend, rotate. And there are lots of combinations, and for all the combinations there are also different techniques. But we have noticed with Teemu in practice, many of these combinations and problems can be solved with the same stretches and techniques. It might be entirely possible that these techniques don't directly mobilize the SI joint, but results are what matter, and many of our clients have had help from these techniques, so why not try? A warning, all of the exercises you find online do at your own risk, and do not do these exercises if you have fractures, strains, sprains, inflammation in the region, or any other suspicious pathologies. Also, if you're pregnant or otherwise hesitate if you can do this, then contact your doctor. Let's start with the first exercise, the posterior pelvic tilt stretch. Lie on your back, straighten one leg, and then pull the other knee towards your chest until you feel a slight stretch in the glutes. If you're hypermobile, you might not feel anything, but pull the knee as far as you can in this case. Otherwise, only to the first sensation of a stretch. Now start to push the knee from you while you resist with your hands for 10 seconds, and the contraction should be 40 to 60% of your maximum contraction. After 10 seconds, relax and then pull the knee further if you can to increase the stretch. Repeat the contraction, so start to push your knee away and then resist it with your hands. And the both exercises that I will show you, do these exercises for both sides if you are unsure which side is problematic, because it's not clear if the side that is twisted is the problem. The second exercise is the anterior pelvic tilt stretch. Lie on your stomach and place a foam roller under one knee, and then flex the knee, bend the knee until you feel a stretch. a slight stretch in the front of your thigh, so in your quadriceps muscle. Then start to push the knee into the foam roller for 10 seconds and again 40 to 60% of your maximum contraction. And keep it there, like this. And this shouldn't be painful. So if there's pain, then put a pillow under your stomach so that your back isn't as arched. Or then don't bend your knee as far. Do it like this. Now, next comes the genius of a foam roller. It's round, so you can roll it forward. And now when it goes further towards your hip, the extension of your hip increases, so the stretch should ideally increase in your case. And now again start to push your femur into the foam roller for 10 seconds. And then relax. And then if you can, take it even further. If not, then do it in the same place, in the same position. And now again, start to push it there. And no pain should be felt. And do this also to the other side if you're unsure which side is the problem. Do these exercises 5 days in a row. And if you don't get any results with it, then you need to focus more on the strengthening and coordination side of your pelvis and low back. After 5 days, continue using them once or thrice a week. The SI joint includes more than just the joint. It's relevant to take into account the muscles that support it, the abdomen muscles, the low back muscles, and the pelvic muscles, also the hips. If you are interested in these topics and you want to learn more about the low back and pelvis, then let us know. Don't hesitate. It's the only hot day of the year in Finland and I'm getting sweaty just by existing, so I need to go to the shower. Bye.